afternoon, everyone. Thank you for attending this Parenting Insights talk. Babies start learning from the moment they are born by observing what's going on around them, by watching their parents. One striking illustration of this is the fact that some studies have shown babies as young as 6 months of age can already recognize the brand of the formula that parents give them. So just by going to the shops with them or seeing it in the kitchen, they remember it. So imagine if they can remember such an important thing as a brand, what it must be for important things for them, such as the relationship with their parents or people around them, or when it comes to food, for eating habits. So Infancy counts, and that's why I'm giving this talk today. My name is Agnes Gelmini. I'm a psychologist and early childhood educator, and I'm currently conducting a research at the Parenting and Family Support Center at the University of Queensland. I'll be talking about promoting health and wellness in babies, and although there are many levels and ways in promoting babies' health, I'll be focusing today on healthy eating. Now, before we dive into the content, just one precision. I'll be talking about feeding from the moment parents have started introducing solid food in their baby's diet, because babies who are still exclusively breastfed or formula-fed, it's a whole topic in itself, and it's far beyond the scope of this talk. I'd like also to thank the director of the Expo for offering me to talk to you today, and thank you for Catherine for the beautiful organization. So I'll briefly talk about the importance of infancy and some of the challenges that parents face in raising a healthy baby today, and especially in feeding their baby. I'll talk about how to create positive mealtime environment and how to encourage good eating habits at the table. I'll talk about the importance of listening to your baby's cues, and when it comes to food, what to focus on. And finally, I'll introduce my research project, which is a triple P seminar called Baby Healthy Living. It's never too early to set healthy habits from the start. First, because, as I said, babies start learning from the very beginning, but also because it's much easier to learn healthy habits than to change unhealthy ones, as we, as adults, know it quite well. So in infancy, parents have a wonderful opportunity to set the foundations for healthy habits for their children's life. And there are many things that happen in infancy and many things that are embedded in the first years of life. So when we think about food and feeding, our tastes and food preferences are embedded in those very first years. And more than that, they are likely to remain throughout our entire life. So if you think about, as adults, we are often fond of the certain foods that we used to have as children. And for example, if your mom used to bake a special cake for your birthday or a special meal, I'm sure that you still like those foods. So starting early is important. Now, parents face certainly a lot of different challenges in raising a healthy baby today. We do have a lot of pressure at work, and we have to juggle between work, childcare, household chores. As a society, we face important issues such as obesity, starting as early as toddlerhood or even infancy. And overall, we are bombarded every day by lots of information about lots of things, and sometimes it's really hard to know what to do. For example, when it comes to food choices, we have so many choices. And those challenges certainly lead to a lot of stress and can make parenting harder. When it comes to feeding, well, here is a list of some of the problems that parents face when feeding their babies, and they're all based on true cases because they come from the parenting groups that I run. And during those groups, parents often report having problems such as fussy eaters or picky eaters, children who would eat only a limited variety of foods, such as only pizzas or bread, Parents also report their babies or toddlers going through taste phases. So they would, for example, love mashed potato one day and hate it the next day, which is pretty upsetting for parents. Parents also report children throwing tantrums when parents try to introduce new food on their plates. And parents also worry about, for example, their babies not putting enough weight or, on the contrary, putting too much weight. And the list goes on. And it's true that those challenges around, or those difficulties around mealtime can be really challenging. And when you get that on a regular basis, it's understandable that it leads to that often. So it's true that those difficulties around mealtimes can be really challenging for parents to manage. But it's also pretty common. About 40% of parents experience those problem eating with their children. So what can parents do about it? And what kind of strategy can then use to manage those difficulties around mealtimes? Well, there's one thing that we know is that creating a positive mealtime environment is important. So mealtimes are not just about putting food down there. It's also about sharing a moment and enjoying food. So the idea here is to try to eat together as a family with your baby and toddler as much as possible. And for parents, it's a great time and a great opportunity to talk about their day, to talk to each other, to listen to what their older children might have to tell them, stories they want to tell, and to pay attention to your baby or to your toddler, to interact with them. And also to talk about food, how much you enjoy it, and maybe pay compliments to the person who has cooked the meal. So yeah, creating this positive atmosphere is important because this is the context in which your baby is going to learn to eat hopefully a good range of different foods and to enjoy it. When you are sitting at the table with your babies, when parents are sitting with their babies and toddlers or children, it's a great time to encourage good eating habits. So, for example, if we think about good table manners, well, just by modeling good table manners, children will observe their parents, and just by watching them will learn a lot. Or with thinking of increasing food variety. When parents already eat quite a lot of different types of foods, well, those foods are already familiar to their children, and children are then more likely to eat them and maybe even more to like them in the end. Another good strategy to encourage good eating habits at the table is to praise your child for behaving well at the table. So let's say if your child used their spoon to feed themselves, you can praise them for doing so. Or if they try a new food, you can compliment them for trying the broccoli today. Another important point that parents can remember around mealtimes is to listen to your baby's cues. Now, I have a question for you. If you are given a huge, beautiful slice of melting chocolate cake after a good meal, are you more likely to eat just a couple of mouthfuls and then leave the slice on the plate? Or are you more likely, like many adults, and me including, to eat it all and even try to get some more because it's delicious? Well, that's what we tend to do as adults, but it's different for babies. Most babies actually respond very well to their own appetite. So it's good for parents to listen to their baby's cues. And let's say, for example, typically when a baby turns their head away or pushes the spoon away, that's a sign for parents that the baby might not be hungry or might be full. And parents can quite confidently end the meal. Now, when it comes to food and what to give to your baby, it's always good to read the labels and to turn to the official nutritional guidelines. But the point that I'd like to emphasize here is that it's to think about the food not just for your baby, but the food that you offer to your family as a whole. What is put on the table? because the idea is to try to offer a good range of reasonably healthy foods, to limit the unhealthy foods, and then to let the children pick from those choices that are on the table. It's just that it's much easier to choose or to make the right choices from a range of healthy food than to have to say no to unhealthy foods. Typically, when you go to a party and you have all those delicious foods that might not be so good for you, it's difficult to resist and to say no. Whereas I was at the market this morning and I was looking at all those stands with those samples of delicious fruits. It's really easy when it's offered to pick this with a guilt-free mind. Now, there are times, no matter what parents try, how hard they try, children are children, they will still misbehave, they might still have difficulties around meal times. And in those situations, the best that parents can do is to try to remain patient and to persist with the good strategies that they're already using with their children, and to try to keep this positive atmosphere that I've talked before, because this is important. This is the context in which your child learns to appreciate food. And to help parents do that, remain calm and patient as much as possible, there's certainly a range of different coping strategies that exist, such as abdominal breathing or coping statements. Now, those 3 P's here, PPP, give me a nice link to the next slide, because I'm going to introduce you to the triple P. You might have heard about it. Triple P stands for Positive Parenting Program. It's a system of programs, of parenting programs that have been developed at the University of Queensland at the Parenting and Family Support Centre by Professor Matt Stanzes and his team. It's based on more than 30 years of ongoing research, so it's one of the only parenting programs that is out there that is actually evidence-based and proven to be effective for parents. It's used now, I think, in more than 27 countries around the world, and parents report that it's useful to reduce parenting stress, enhance relationship within the family, and also help them manage specific problem behaviors that they might have with their children. So with this project, it's a new seminar. It's called the Baby Healthy Living, and what we hope to do with this one is to make a difference in helping parents promote their baby's health and wellness. And what it is exactly, so the aim is to support parents in promoting health and wellness in their babies, and with this study we want to know if this new seminar is helpful for parents or not. It's been designed for parents with babies between 4 and 18 months of age, and parents who are eligible to participate in the study will get a free 2-hour workshop. And the content that we cover in the workshop is, so most of the topics that I've talked about today, we're talking about them, but in much more depth and detail. So the importance of infancy and the challenges that parents face in raising healthy babies in our society. We also talk about topics such as recognizing baby's healthy growth and how to get active with your baby. And we do get into more detail, and we give practical strategies. We teach parents strategies to encourage good eating habits at the table, and also how to increase food variety. We talk about strategies to set early limits to babies and toddlers, and also coping strategies to talk back to stress and to manage those negative emotions that can come with parenting. So you too, in participating, you can help making a difference and help other parents raise healthy babies. So just a few key messages that I've tried to give you today. I've talked about the importance of infancy and how it's a great opportunity for parents to set the foundations of healthy habits from the start. Parents can also face the challenges of feeding the baby by creating positive mealtime environment and to encourage good eating habits at the table. It's also important for parents to listen to their baby's cues and offer a range of reasonably healthy foods that their children can pick from. And parents can also use coping strategies to help them manage stress that often is related to parenting. And finally, I've introduced the new seminar, Triple P seminar, the Baby Healthy Living. If you're interested in this project or in the Triple P in general, if you'd like to get more information, you can meet us at booth 830. Thank you very much for your attention.